Now normally, this is my favorite part of the lecture, where I put a red arrow on the slide and everyone in the audience shouts out what that arrow is pointing to anatomically. It's going to have to work a little differently now that we're doing this online, but we'll see if we can make it work. These are two transaxial images from a CT scan, this one a little lower down and this one a little more superior, both of them going through the brain. You'll notice that some basic concepts apply. For example, dense objects are going to be brighter, whiter on the image, and less dense objects are going to be darker on the image. And you have to get used to how dark or how light it is on any given image. So what's this white thing that goes all the way around the outside? That's right, that's the skull. We're starting easy here. We're going to work our way up to more difficult items. Well, how about these things? I'm pointing to the darker objects here, a little bit there, this item there. What are these dark objects? Well, water is going to be darker on CT, and these water-filled objects are the ventricles. In the case of the arrows, the lateral ventricles, pointing to the body of the lateral ventricle over here and the atrium of the right lateral ventricle over there. Well then, what's this super dense thing, Mr. Water in the ventricles? That super dense thing is dense because it has calcium in it. Just like the calcium in the skull, there's calcium in this object right here. That object happens to be the choroid plexus. The choroid plexus, which belongs there in the atrium of the lateral ventricle, the choroid plexus calcifies early in life in essentially everybody. So that's an expected finding, calcium in the choroid plexus within the ventricle. Here I'm pointing to a brighter stripe, this sort of U-shaped thing right here. What is all of that? Well, that's the gray matter, right? That's gray matter. And obviously, the designations gray matter and white matter were given by a pathologist doing gross specimens and not by a radiologist, because on a CT scan, the gray matter is whiter and the white matter is grayer, right? So this denser material, this ribbon of dense material that goes all the way around the outside of the brain, that's the gray matter. Those are gyri. And the white matter is the less dense material deeper down. How about this straight line running from the front to the back? It skips the middle, but running from the front to the back, right down the center. What's that? That is the falx cerebri, right? This is a thick, dense, quadruple layer of dura that separates the two hemispheres from one another. It takes a lot of force to displace the falx cerebri. This arrow is along this line, this curved line right here, sort of a J shape, I suppose. What's that object? Well, that is the Sylvian fissure, right? It is filled with CSF, just like the ventricles, same color as the ventricles, so full of water. CSF and water are essentially the same thing. CSF is essentially water. It's got a few things dissolved in it, but it's essentially water from a physics perspective. So there's water in this object, and that is the largest of the sulci, the Sylvian fissure. The Sylvian fissure separates the temporal lobe from the insula. Well, what about this dark object right there? What's that? Well, there's dark and then there's dark. I mean, yeah, the CSF is dark, but that is just as dark as the air surrounding the patient. That's because it is full of air. And this is the frontal sinus, right? It's supposed to be filled with air. And those are the paired frontal sinuses in your forehead. Now that we've seen the anatomy on CT, let's switch over to MRI. We're going to play the same game here because the anatomy is all the same, just the colors have changed. This T2 weighted axial image from an MRI is aligned pretty closely with one of those CT images that we were just looking at. So all of the anatomy is going to be the same, just the colors are going to be different. Let's run through it. What is this really white, brightest thing on the image here? Well, on a T2 weighted image, the CSF is bright, the water is bright, and that is CSF. Here it is in the atrium of the lateral ventricle, and here it is at the opening of the Sylvian fissure coming back. Right? CSF. How about these things? Here I'm looking at this object. If you look closely, you can see me outline this almond-shaped object and this sort of elongated triangle here. What are those? Well, those are the basal ganglia, right? This is gray matter, same color as that stripe of gray matter around the outside. This is gray matter that is embedded deep within the brain. And more specifically, we can break down the basal ganglia into the caudate nucleus. This is the head of the caudate nucleus. And the lentiform nucleus, which can be broken down further into the putamen out here and the globus pallidus more medially, right? And we know that that's the anterior limb of the internal capsule separating them. What's out here? What's this black thing running all the way around the outside? That is the skull. Remember when I said that MRI was not so good at bones? Here it is, MRI being not so good at bones. You can't see anything, maybe a couple of veins running through the skull, but you can't make out any detail within the skull itself. The skull contributes almost no signal on any of these MR sequences, at least not the hard parts. Now here's an advantage of MRI, is its multiplanar capability. So we're going to take a sagittal midline image and we're going to do the same thing here. Look at some anatomy that shows up best on the sagittal image as opposed to the axial images. We don't get to do this in CT, it's just MRI. How about this thick object right here? It's right down the middle of the brain, right? Running front to back there. This is the corpus callosum that connects the two hemispheres of the brain, right? And that's about a normal thickness for a corpus callosum. That's how thick you want it to be. What's this item hanging down off the bottom of the brain? This is a gland, and it's got its own little house to live in here. That house is called the sella turcica, and this gland is the pituitary gland hanging down. It is surrounded to variable degrees by the sphenoid sinus, right? That's got air just like the air out here, just like the air in the nasopharynx. The sphenoid sinus filled with air surrounding the sella turcica where the pituitary gland lives. How about this thing? It looks like it looks like a pregnant penguin with this bulge out the front. Well, this is all the brainstem, and the part that looks pregnant, that's the pons, right? The central part of the brainstem, or the pons, right? So what's this triangle right there? It's that triangle of darker material. Well, this area right here between the pons and the cerebellum is the fourth ventricle. Now you're thinking, I thought the fourth ventricle looked sort of oval. The fourth ventricle looks oval when you cut it transversely, but it's got this complex three-dimensional shape, and so it's a triangle when you cut it in sagittal plane. Here I'm pointing to this thin dark line right there. That is the aqueduct, either the cerebral aqueduct or the Sylvian aqueduct, either one's fine. It's connecting the third ventricle down to the fourth ventricle, running right through the midbrain, right? Separating the anterior midbrain from the tectum in the back. That's the cerebral aqueduct. Here I'm pointing to something that's running just inside the skull. And it's running all the way along, right down the midline in the sagittal plane underneath the skull. This is actually a vein. It is the superior sagittal sinus, right? And it runs all the way along the top of the falx over top of the brain. Now let's talk about the meninges, and in particular, how the different layers of the meninges divide the intracranial vault into different spaces. On the outside, the most exterior layer, you have the dura mater. The dura mater is the thickest of the meningeal layers. That's why it's called the pachymeninges. And it is like a bag around the entire brain. It does infold on itself in a couple of places, like the falx cerebri that we talked about before, and the tentorium cerebelli. But it is mostly a big bag all the way around the outside of the brain attached to the inner surface of the skull. Just in from that is the arachnoid mater. And for the most part, the arachnoid follows the dura. It's like a big bag around the outside of the brain. The third layer, the innermost layer, is the pia mater. And the pia mater follows the infoldings of the brain. The pia mater comes down into each sulcus, turns around, and comes back out again to the exterior of the brain parenchyma. The pia mater is densely adherent to the brain itself. Now, if we take these three layers of the meninges and we think of them as dividing planes, this divides the intracranial vault into 4 potential spaces. If you are outside the dura mater, in between the skull and the dura mater, you are in the epidural space. If you are between the dura mater and the arachnoid, you are in the subdural space. If you are between the arachnoid and the pia mater, you are in the subarachnoid space. And if you are deep to the pia mater, you are essentially inside the brain. You are intraparenchymal if you are inside the pia mater. So 3 different layers of meninges divide the intracranial vault into 4 spaces: epidural, subdural, subarachnoid, and intraparenchymal. We'll come back to this when we talk about the different places that pathology can be within the intracranial vault. These are 2 CT images obtained from 2 different patients. And I'd like for you to consider the question, which of these is a normal brain? So this one is a normal brain, and this one is also a normal brain. This is a 19-year-old brain, and this is a 90-year-old brain. There is a normal process of atrophy that is inevitable, that we all undergo as we get older. Even as you are sitting here listening to this lecture, your brain is slowly atrophying from this into this. In order to understand what's normal for any individual patient, you have to have a sense of what the range of normal atrophy is for someone of that age. It's not going to be the same for every single person, but there's a range of expected findings. So if I saw a 19-year-old whose brain looked like this, I would think that's strikingly abnormal. But if I saw a 90-year-old whose brain looked like this, that would also be strikingly abnormal. Each of these is normal for that person's age. We talked earlier about anatomy of a vertebra. Let's delve into that into a little bit more detail. This portion of the vertebra is the vertebral body. Extending back on either side are the pedicles of the vertebra. And then this area of the posterior elements is called the pars interarticularis, which runs in between the facet joints. Extending out sideways are the transverse processes, and extending back is the spinous process. And here you can see the joints between this vertebral body and the one above. These are the facet joints. Again, I'll emphasize how in the spinal canal, without the use of contrast, hard to tell things apart. How about spinal anatomy as viewed on MRI? One thing to notice in this T2-weighted image of the thoracic spine is what the vertebral bodies look like. They look like rectangles, and they have this little stripe right down the center towards the dorsal side of the vertebral body. That's a vein draining blood from the vertebral body itself, and that's normal. Notice the alternating pattern between vertebral body disc, vertebra, disc. That is the expected pattern in all parts of the spine. Notice how dark the spinal cord is compared to the surrounding CSF on a T2-weighted image. It may look like the spinal cord is getting thin right through here, but once again, that's just the spinal cord coming in and out of the image that we happen to be looking at. And if we chose the next image order, this would look fatter and these would look thinner. The spinal cord is not a perfectly uniform column. It does get larger and smaller in some areas, but this here is artifactual. Some similar appearance here in the lumbar spine. Notice again that we are alternating between vertebra, disc, vertebra, disc, vertebra, disc. We're going to come back to that later on. Notice also that there is a nice smooth line of the posterior longitudinal ligament that is running behind the vertebral bodies. Notice how smooth it is as it passes from one vertebra to the next across that intervening disc. Still very smooth line. Hey, what happened to the spinal cord? A little while ago we had a spinal cord running through the thoracic region of the spine. Where is that here? Well, the spinal cord doesn't go all the way to the bottom of the thecal sac. It terminates somewhere around the thoracolumbar junction, and so all we have left when we get down to this level are the nerve roots sitting in the cauda equina extending out through the foramina. Let's move on now to vascular anatomy. This is one of Dr. Netter's famous drawings. This is the brain as seen from the undersurface so that you can see the arterial inflow. These are the internal carotid arteries, right? And here they are branching into the middle and anterior cerebral arteries. These are the two vertebral arteries coming together to form the basilar artery. And as it comes up to the top, it terminates and forms both of the posterior cerebral arteries. Now there are communicating arteries, the anterior communicating artery between the anterior cerebral arteries and the posterior communicating arteries between the internal carotid artery and the posterior cerebral artery. And taken together, all of the arterial structures I've just talked to you about form a circle of communication called the circle of Willis, and this is the collateral system for the brain itself. Let's now turn and see how this arterial anatomy manifests radiologically. Here's a digital subtraction angiogram like the one we were talking about earlier. This is a frontal, slightly oblique, but essentially a frontal projection where this is one orbit, that's another orbit. This is an injection into the internal carotid artery, and you can see the artery sweeping up through the skull base and up into the intracranial vault where it is supplying the arteries of the brain. Let's break this down a little bit and look at the individual elements. What is this point right here? Well, this is where the internal carotid artery comes to its terminus. So terminus of the internal carotid artery, and that is the branch point where the internal carotid artery ends and its two daughter branches begin. So this one that's headed out laterally, the larger artery that heads out laterally, that is the middle cerebral artery. This artery that heads out medially, that's the anterior cerebral artery. What's going on here? That looks like there's a big ball right in the middle of the internal carotid artery. Well, that's not real. That's an artifact that comes from the fact that we are taking a complex three-dimensional structure, this artery, and squishing it down into 2 dimensions in a frontal projection. If we are able to look at this from the side, and we're going to do that in a second, when we look at this from the side, it's actually that this artery is coming towards you, turning around, and then headed away from you. And when it's coming straight towards you, you're looking at it end on, and it just looks like a circle. Let me show you what that looks like when we look at it from the side. Here is the same injection as seen from the side. In fact, the frontal and lateral projections are acquired simultaneously when we perform this examination. Now the eye is out front, right? This is the front of the skull, this is the back of the skull, and we're looking from the side. Here comes that internal carotid artery. Here it is snaking up through the skull base. We don't see that quite as well on this projection. But here it is swinging forward, turning around, and swinging back again. This is called the carotid siphon. And you can imagine that if you were looking at this artery from the front, it would just look like a circle. You'd be seeing it head on. And that's what we saw in that last slide. We saw the internal carotid artery seen head on as it's coming straight towards you, then turning around and headed straight back again. So why don't we always look at the internal carotid artery from this perspective? And the answer is that we've lost that beautiful view of the middle and anterior cerebral arteries and the internal carotid bifurcation. It's all lost in the tangle of vessels, whereas it was splayed out so clearly for us on that previous image. I sometimes get asked, what's going on right here? How come it's a nice dark tube coming up and then all of a sudden it gets lighter? Did the artery somehow get thinner there? The answer is that this is also an artifact. The digital subtraction technique is really pretty good, but it's not perfect. And when you transition from the soft tissues of the neck to the dense bones of the skull base, the subtraction doesn't work perfectly. And so you're seeing that transition from the neck into the skull base. This is to remind me to talk about the siphon. So what's this coming forward? What artery is this? It's a branch of the internal carotid artery, and it's coming right off of the siphon, and it's headed forward. That's our ophthalmic artery, and it's going to be feeding the eye. That's a reminder about the skull base. What's this artery headed back? Well, it's coming off of the distal portion of the internal carotid artery, and it's headed back and it's feeding into the posterior cerebral artery. That's our posterior communicating artery headed posteriorly. This is another of Dr. Netter's diagrams showing the same anatomy we were just talking about in the lateral projection. You can see the internal carotid artery coming up through the skull base and the carotid siphon swinging forward before heading up to its bifurcation intracranially. He's even depicted the anterior communicating artery. So at the risk of beating a dead horse, I'm really going to try and hammer this home. This idea that something that you see well in one projection is seen poorly in another. Here is the internal carotid artery in the frontal projection, and you just can't get a good look at that siphon because it's headed right towards you. But when you see the same thing in the lateral projection, it really lays out nicely. Whereas the bifurcation between the middle and anterior cerebral arteries shows up well in the frontal plane, but it's just a tangled mess in the lateral projection. Okay, let's do the same thing for the posterior circulation. Let's look at the anatomic structures. This is another frontal projection, but this time we've injected into one of the vertebral arteries instead of the carotid artery. So what's this artery here? Well, that is the left vertebral artery. The injection came from below, is flowing up, the artery swings out laterally, then swings forward, and then comes up onto the brainstem. So what's this artery here? Well, once the vertebral artery meets its counterpart from the other side, it forms the basilar artery. One question that I get asked a lot is, why is the other vertebral artery filling? Shouldn't it be flowing superiorly, just like this side? Why do we see any contrast in it at all if the injection was on the other side? The answer is that we're injecting so hard, we're refluxing contrast back down and forcing this vertebral artery to flow retrograde for a little while we do the injection. Don't worry, once we stop injecting, it'll start flowing forward once again. What's this point right here? Well, this point is called the basilar tip, and this is where the basilar artery ends and the posterior cerebral arteries begin. I've been showing you a lot of pictures of catheter angiograms, but it turns out you don't need to put a tube inside a person to get a really nice picture of their arterial structures. This picture is called an arteriogram, and you can see all the same anatomy that we were just looking at, but it's done without the use of a catheter. So here's the common carotid artery, there's the carotid bifurcations, internal carotid artery is coming up, and you can see the carotid siphon right there, and here's branching into the middle and anterior cerebral arteries. At the same time, you can see the posterior circulation, the vertebral arteries coming up, joining together to form the basilar artery there. The point of this is just that using CT and MR, we can get a lot of the same information that we can get from catheter angiography without the risk of intervention.